My response to Connecticut Bills 5397 and 477. Welcome to another installment of the Connecticut Gun Bench. Today's video is brought to you by P.A.N. Firearms, LLC. P.A.N. Firearms for your NRA certification and multifaceted gun training. You can reach us at 203-300-6343 or visit our website at www.panfirearmsllc.com. As always, there'll be a link in the description box below. But let's talk about this. For the February session of 2022, the governor and the state in general has presented a multitude of what could be considered and are anti-gun bills. Now, in a previous video, I discussed the governor's bill, SB 16, which in effect will pretty much end the other market in Connecticut and also the pre-ban exception from SB 1160. Now, we look at these bills, and if I go, I'm going to bring them both up here. But starting with 5397, the title alone just raises all kinds of questions. Here it is: an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention and Advisory Council on Gun Violence Prevention and Intervention. So gun violence is a public health crisis. Not violence, gun violence is a public health crisis. Right away, if you can't smell the hypocrisy, then I don't know what to tell you. But Section 1, new. This is effective July 1st, 2022. It is hereby declared that gun violence constitutes a public health crisis in the state and will continue to constitute a public health crisis until the goal set forth in subsection B of Section 2 of this act is attained. Now, that's all good and said, but then I'm going to scroll down to, because I want to show this part here. It's line 111. I'm going to move down to 111. That's on page, it's going to be on page 7. Now this is how this advisory board for the Office of Gun Prevention, or Gun Violence Prevention, this is how the advisory board is chosen. The advisory council shall be comprised of at least one member from each of the following categories, who shall be appointed by the Director of Office of Gun Violence Prevention. 1. Individuals impacted by gun violence. 2. Organizations with expertise in gun violence prevention. 3. Law enforcement. 4. Communities of color, as described in Section 17B-857 of the General Statutes impacted by gun violence. 5. Researchers of gun violence. And 6. Public health experts. So it is very, very clear that what is happening here, this advisory council is going to be loaded with people with a singular point of view when it comes to not so much violence, but firearms in general. And it's obvious they're overloading this council with people who are going to make rules that are going to affect the gun community. Not necessarily in the face of impact of violence, but just the gun community in general. I'm going to go over here to another raised bill, number 477. This is a February session, same thing, February session of 2022. And it's an act concerning the public health of residents of the state. Now, the title sounds very good. The title sounds peachy, if you want. Page 13, line 229 of Bill 477, Section 7, new, effective from passage A. There is established a Commission on Gun Violence Intervention and Prevention to coordinate the funding and implementation of evidence-based, evidence-informed, community-centric gun programs and strategies to reduce community gun violence in the state. Does that not sound exactly like the commission that they're trying to put together in the previous bill of 5397? Just remember, we already have a commission on gun violence, which was established after Sandy Hook. Now they're trying to put 2 more in place. One is basically in the judiciary. These 2 are in a public health realm. So Section 7 new, and then Okay. The commission shall be part of the legislative department. The commission shall be composed of the following members: 2 appointed by the Speaker of the House of Representatives, one of whom shall be a representative of the Connecticut Hospital Association, and one of whom shall be a representative of Compass Youth Collaborative. 2 appointed by the President pro tempore of the state, one of whom shall be a representative of the Connecticut Violence Intervention Program, and one of whom shall be a representative of Regional Youth Adult Social Action Partnership. 3, 2 appointed by the Majority Leader of the House of Representatives, one of whom shall be a representative of Hartford Communities That Care Incorporated, and one of whom shall be a representative of Connecticut Against Gun Violence. 4, 2 appointed by the Majority Leader of the state, one of whom shall be a representative of Project Longevity, and one of whom shall be a representative of St. Francis Hospital and Medical Center. 5, 2 appointed by the Minority Leader of the House of Representatives, one of whom shall be a representative of Yale New Haven Hospital, and one of whom shall be a representative of Greater Bridgeport Adolescents Program. 6, 2 appointed by the Minority Leader of the Senate, one of whom shall be a representative of Hartford Hospital, and one of whom shall be a youth representative of the Connecticut Justice Alliance. 7, 2 appointed by the House Chairperson of the Joint Standing Committee of the General Assembly, having cognizance of matters relating to public health, one of whom shall be a representative of the Greater Bridgeport Area Prevention Program, and one of whom shall be a parent member of the Two Generation Initiative. 8, 2 appointed by the Senate Chairperson of the Joint Standing Committee of the General Assembly, having cognizance of matters relating to public health, one of whom shall be a representative of Mothers United Against Violence, and one of whom shall be a representative of violent crime survivors. 9, 1 appointed by the Executive Director of the Commission on Women, Children, Seniors, Equity, and Opportunity, who shall be a representative of the Health Alliance for Violence Intervention. 10, 2 appointed by the Commissioner of Public Health, who shall be representatives of the Department of Public Health Injury and Violence Surveillance Unit. Why did I read all that? Because I want to show you exactly how lopsided this whole process is, and the people that they want to be on this board deciding on, quote unquote, gun violence. Not violence, gun violence. A whole bunch of people with a singular point of view who are going to have a singular ideal in how to deal with it. How to deal with violence in general, which means they're not going to deal with violence. They're going to deal with violence as it pertains to firearms, which was going to lead to suggestions that everyone here knows is going to be, we need to ban this and ban that and ban this. And that's exactly what this is all about. They now have used this notion of public health risk and gun violence as a public health issue to be able to circumvent the Constitution. Just as, remember, Governor Cuomo did this, I want to say before he got disgraced and he left office, he did the same thing in New York, declaring gun violence, not violence, gun violence as a public health risk, because that allows him to open up all kinds of funding and allows him, once again, I pointed out before, to circumvent the Constitution. Now, I believe it was Monday, March 28th, there was a public hearing on these specific bills, along with numerous others, but these specific bills, and I did speak my piece at that hearing. If you watch my last video where I, put my testimony out from, it was a March 14th hearing, you see that my style is basically, I don't talk to the legislators, because why? They're going to do what they're going to do. So why talk to them? I try talking to you, we the people. I try to get you informed and involved. So in that style, my testimony on the 28th was pretty much the same thing. So I got that for you here. I just want to point out one thing. I misquoted one of the bills. I said 5937 when it's 5397. I have 3 minutes, so I didn't bother to correct myself, so I apologize for that. But here's that testimony here.
Next, we will hear from number 91, Derek Reeves.
Good evening.
Good evening.
I'm here to put forward a clear and strenuous objection to the bills 5937 and, in part, House Bill 477. Right out of the gate, the falsehood displayed within the title of 5937 is a long conversation by itself but I only have 3 minutes, so I'll adhere to basic common sense. At what point did we decide as a society that a life being taken by a firearm took precedent over any other implementation of causation in a person's demise? When did being killed by a firearm, and a specific firearm, become more heinous, more hurtful, more mentally and emotionally painful to those close to the victim than any other manner of nefarious death? If this is truly about violence, why isn't there a health epidemic declaration on knife violence, SUV violence, the murder of a man's wife and children in a botched home invasion? I don't have to reveal the politics behind this agenda with this proposed legislation because it's clear to me. With regard to HB 477, I'm not opposed to the concept, because who doesn't want to facilitate those who need help in the capacity that the bill refers to? But the title of the bill is hiding an ominous and questionable expenditure. Section 7, that is, establish a committee to study gun violence intervention and prevention. And how these commissioners, who are unelected, are chosen gives every indication of a majority with a one-minded agenda that now has millions of dollars in public funding to push a singular point of view under the guise of health and well-being. No decent moral person would be against reducing violence, but when it's used as a prop to cover up other intentions, then I must call it out. You want to reduce gun-related crime, but you never ask those well-versed in firearms for any iota of input. Enacting gun control, and this is what this is, regardless of the colorful and misleading titles of two bills in questions, through a backdoor to circumvent the Constitution by declaring only gun violence as an epidemic, which is not only disturbing, but once again underhanded. I speak to the constitutionalists and gun owners. The people pushing this are going to do what they're going to do. Remember the public backlash from the Tolls Initiative. We need to have the same energy. March 14th, I spoke at that public hearing for Governor's Bill number 16. I call for unity among us. We the people, because the attitude of this doesn't affect me, was not a pedestal to stand on. Declaring gun violence an epidemic is going to have a direct effect on you. I say again, unite or accept the consequences of inaction. Thank you very much. I'll take any questions.
Thank you, Mr. Reeves. I don't see any hands raised. Thank you for your testimony and your time tonight.
Thank you very much.
Now, since that hearing, there has been some developments. From my understanding, 5397, the bill declaring gun violence as a public health crisis, has been, for now, basically has not been forwarded. But 477 has been forwarded, even though technically the wording within 477 in establishing a committee on gun violence and intervention is pretty much the same language in both bills. So they're kind of getting what they want anyway if they get this thing through. But a good place to go check out is the CCDL Facebook page. There's always information there. They're always updating what's going on with these bills. But I don't have to summarize. I don't have to point out what's going on here. They are literally using the health system as a backdoor to gun control. That's what this is about. You heard me say it in the video. Notice nobody had any questions for me because I really want them to tell me why they think that being killed by a firearm is somehow more nefarious than being killed any other way. Because they don't have an answer. And they damn well know they don't have an answer. But Connecticut gun owners have to definitely be, if 477 goes to the Senate and it passes through, you know Lamont's going to sign off on it. So we have got to start our writing campaigns to our area reps and start letting them know that, you know, this is not going to prevent violence. They know this, we know this, but it's not about that. It's about curtailing the Second Amendment in the state. That's what this is all about. And if you don't say anything, and if you don't do anything, if you take on the attitude, well, it doesn't affect me, well, guess what? Doing this through the public health system is going to affect you. Because they can easily say, well, if we want to reduce gun violence specifically, which is disingenuous a statement as it comes, let's eliminate all semi-automatics as a public health crisis. So this does affect every single one of us, regardless of the firearm that you have in your possession. the 50 BMG or a 22 cricket, doesn't matter. This is going to have an effect on you. So we need to be vocal. We need to be vocal. We need to step up. We need to stand up. We need to speak up. Not necessarily in that order, but we need to do something, every single one of us. And as I go back, I'm going to refer back to the video that I made about SB 16. At that public hearing, there were a lot of different groups who came out against SB 16, which is the governor's bill. A lot of different groups came out against it. Okay, including, it was interesting to see Black Lives Matter come out against SB 16. Now, I don't know the status of SB 16, which is the governor's bill. I don't know the status of it, but as soon as it comes forward, I'm definitely going to be on top of it. But we need more voices from all sides, because I don't care what special interest groups you're attaching yourself to. When this one issue comes in that affects the entire state, we are all affected regardless of where we put our other interests, where we put our other ideals into. This is the one issue we can unite on. Banning firearms does not reduce violence. I don't have to point that out to people with an iota of common sense. But let me know what you think. As always, you can leave your comments in the comment section below. Any calls to violence or statements that lead to violence will be removed. Please like, share, and subscribe. Make sure you hit the notification bell so you get notified the next time a video goes live, and I will see you on the next one. Peace.